Routine venipuncture guidelines. Safety. Observe universal safety precautions. Observe all applicable isolation procedures. Wash hands in warm, running water with the chlorhexidine gluconate hand washing product. Gloves are to be worn during all phlebotomies and changed between patient collections. Palpation of phlebotomy site may be performed without gloves, providing the skin is not broken. A lab coat or gown must be worn during blood collection procedures. Needles and hubs are single use and are disposed of in an appropriate sharps container as one unit. Gloves are to be discarded in the appropriate container immediately after all phlebotomy procedure. All other items used in the procedure must be disposed of according to proper biohazardous waste disposal policy. Contaminated surfaces must be cleaned with freshly prepared 10% bleach solution. All surfaces are cleaned daily with bleach. In the case of an accidental needle stick, immediately wash the area with an antibacterial soap and express blood from the wound and contact your supervisor. Materials be used: safety needles, butterfly needles, tourniquets, antiseptic, cotton balls, and sharps disposal container. We also have bandages or tape. Procedure. First, we need to identify the patient. Outpatients are called into the phlebotomy area and ask their name and date of birth. This information must match the requisition. And patients are identified by their armband. If it has been removed, a nurse must install a new one before the patient can be drawn. Reassure the patient that the minimum amount of blood required for testing will be drawn. Assemble the necessary equipment appropriate to the patient's physical characteristics. Wash hands and put on gloves. Position the patient with the arm extended to form a straight line from shoulder to wrist. Do not attempt a venipuncture more than twice. Notify your supervisor or patient's physician if unsuccessful. Next is to select the appropriate vein for venipuncture. The larger, median cubital, basilic, and cephalic veins are most frequently used. Apply the tourniquet 3 to 4 inches above the collection site. Never leave the tourniquet on for over 1 minute. If a tourniquet is used for preliminary vein selection, release it and reapply after 2 minutes. Clean the puncture site by making a smooth circular pass over the site with the 70% alcohol pad moving in an outward spiral from the zone of penetration. Allow the skin to dry before proceeding, and do not touch the puncture site after cleaning. Perform the venipuncture. Attach the appropriate needle to the hub by removing the plastic cup over the small end of the needle and reinserting it to the hub, twisting it tight. Remove the plastic cup over a needle and hold bevel up. Pull the skin tight with your thumb or index just below the puncture site. Holding the needle in line with the vein, use a quick, small thrust to penetrate the skin and enter the vein in one smooth motion. Holding the hub securely, insert the first vacuum container tube following proper order to draw into the large end of the hub, penetrating the stopper. Blood should flow into the evacuated tube. After blood starts to flow, release the tourniquet and ask the patient to open his or her hand. When blood flow stops, remove the tube by holding the hub securely, pulling the tube off the needle.